Beatrice Carton from Ndola Teaching Hospital, an infection prevention lead nurse. My role is to ensure that infections are prevented in the hospital by ensuring that all measures are implemented. Infection prevention is basically the activities that is in the transmission of microorganisms. Also to control. If there's an outbreak of an infection, then you implement some measures that will help you to control the spread of infections. It is important because it prevents nosocomial infections or healthcare associated infections.
So technically what you are telling us that infection prevention is a multidisciplinary program, isn't it?
Yes.
How have you been able to coordinate within different disciplines?
Okay, we have two committees.
Okay.
As an institution, we have one committee for focal point person where we draw the members from each department.
Okay.
Then we have heads of departments. We have an infection prevention tool where we check for waste management. We look at the type of bin liners, if they are put in the correct place and in the correct bin.
Okay.
Then it also has the hand hygiene where when we go in a clinical area, we observe whether the members of staff or healthcare workers are practicing good hand hygiene. Okay. Then also we pick one member of staff to demonstrate the hand hygiene techniques. Yes.
Okay. In terms of?
In terms of hand hygiene, then also availability of hand washing, soap, also the alcohol Handrub.
Okay.
Not much.
Okay.
Not much challenges.
Okay.
Though when people are aware that the infection prevention team are coming to audit us, they ensure that everything is put in place.
Okay.
But most of the time, when we are conducting that audit round, we don't really inform the department, but we inform the heads of department. But when the head of department leaks it, they inform their subordinates. Okay. Financial support. We have an allocation in our hospital budget. It has been factored in, so we receive a certain amount of money to procure the IPC commodities and other logistics.
Okay.
Then we also, when we want to implement something, we involve also management to help us to implement whatever we want to implement.
Okay.
Also on trainings, they also support us on training of members of staff.
Okay. No, thank you very much. I think that's where we end this interview.
Okay. Thank you very much.
My name is Ndola. I'm a senior pharmacist at Ndola Teaching Hospital, and I'm in charge of the production unit. We focus mostly on two things. One is the alcohol-based Handrub, also a surgical skin scrub that we produce for the theaters. Well, in 2013, through the African Partnership for Patient Safety, we were partnered with Guy's and St. Thomas. And through that, we were introduced to WHO in 2013. That did a training. So we had two of us who were trained in Zambia, two pharmacists, myself and one other pharmacist, to produce alcohol-based Handrub. So the purpose was to empower low-income countries to be able to produce Handrub in-house. So the WHO calls it in-house production using their formula. Basically, our role does not end here. We hope we'll be able to reach other facilities to be able to train them so that they can start producing Handrub.
Okay.
So one of the biggest challenges is rising price in commodities that we use, raw materials. Yes, we've been seeing a drastic rise of commodities, and basically it means that the production cost goes up. Okay, well, sustainability first starts with management. So management at our hospital has been very helpful in terms that they have allocated us a fixed budget within the finances of the hospital monthly that we are able to utilize to procure the raw materials and any other things that we need. The other thing is also acceptability. The facility and the staff within the facility have been able to accept the Handrub that we produce and have been able to use and demand for it when it's not available. So that has kept us going. We have specific equipment, and bear in mind the WHO formula that we use is a simple formula that has been given to us, which we can use to produce it using very bare minimum requirements in terms of equipment. And most of the equipment that are needed are just glasswares, packaging materials, and a little bit of paper for labeling and all that. So it's not sophisticated equipment that is needed for production, but basic equipment within the reach of these facilities. So the cost of the materials and the equipment is quite minimal. Management asked me to provide a budget of what we needed to kickstart the production. Maintenance is easy because certain equipments do not get broken down very easily. Others are much of packaging material which we just disinfect and repackage. So majority of the packaging material that we use are reusable. So we wash them and then we disinfect them and repackage once and for all. The production process does not require much of staffing. It can be done by one person mostly. One thing I can say is the patent for the formula that we use is WHO. WHO has given us a blessing to use their formula and produce for in-house, bearing in mind that there are certain requirements within each country that are supposed to be met. For example, the fire safety of where you are working from. So even in hospitals, there are certain legal requirements that each institution need to put in place. Basically, according to WHO, it's been given to us to use in-house and not really as in a commercial part, but they have allowed hospitals to remanufacture using their formula and basically help patients and staff in infection prevention within the hospitals where it's being produced.
Okay. Thank you very much.
Thank you very much.
Very much. Actually, this initiative is helping us in the current situation of the outbreak of COVID-19. We are able to have our hand sanitizer. Hand hygiene is one of the preventive measures for COVID-19. So we are happy that we are able to produce hand sanitizer within our hospital, and we are able to meet the demand of the hospital.
So we have adopted the WHO standard for preparing a hand sanitizer, and we use 4 main ingredients, the ones that are displayed. So we use ethanol, distilled water, glycerol, and hydrogen peroxide. So this is the formula that we've adopted in preparing 10 liters of Handrub. So we use 8163 ml of ethanol, that is 98% ethanol, 417 ml of the 3% hydrogen peroxide, 145 ml of glycerol, 98%, and 1205 ml of distilled water. The apparatus that we use, first of all, before we begin our preparation, we quality analyze the ingredients that we have. The two main ingredients that we analyze are the hydrogen peroxide and the ethanol. So to analyze the ethanol, we simply use the alcohometer. Okay? So we use this to test for the ethanol. It goes together with the thermometer. Then to analyze the hydrogen peroxide, we have to use the titration method. So we react the peroxide with the potassium permanganate and sulfuric acid. We do a titration process using the equipment that you're able to see. So it helps us to determine the molarity of the peroxide. That's what we use as the percentage of the peroxide. And depending on the percentage that we find, we titrate it to 3%. When we get 3%, that's what we use in the preparation of our Handrub. That's when we obtain the 417 meals that you're able to see.
How are they mixed? Is it in any kind of order?
Correct. So we have deliberately prepared this sheet for everyone to easily prepare at the same time. Okay? So the first ingredient that we use is ethanol. Then we add the peroxide, then the glycerol and distilled water in that order.
And mix.
And then mix.
Okay.
Yes.
Okay. So after mixing, how do we ensure that it's a quality product that has been produced?
Again, our major ingredient in the preparation is the ethanol. So in the final preparation, we need to test for the percentage of ethanol. We don't necessarily have to test for the percentage of the peroxide, because once we prepare our Handrub, it will be ready within 72 hours, and by then we assume the peroxide would have reacted, it would have formed water. So we don't necessarily have to test for the peroxide. It's just important to test it once we begin the preparation. But afterwards, it's not important. So we just use the alcohometer to test for the final concentration of our ethanol. It should be, as we have put on the label, it should be 80%.
Thank you very much for your time, Mr. Patrick, and for educating us.
You're most welcome.
Thank you.